Over 15 million Americans take a proton pump inhibitor every single day. Omeprazole, pantoprazole, Nexium. Your doctor gave it to you for heartburn, maybe for acid reflux, maybe after a stomach ulcer years ago, and then nobody ever told you to stop. A 2023 study in the journal Neurology found that people who took PPIs for more than 4 years had a 33% higher risk of developing dementia. Your stomach pill is not just sitting in your stomach, it is crossing into your brain. And every year you stay on it, the risk climbs. I'm Dr. Garrett Thornton, 34 years in internal medicine. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. You open your medicine cabinet every morning. There is a row of orange bottles, one for blood pressure, one for cholesterol, and that little capsule you started taking 3 years ago, maybe 5 years ago, because food kept repeating on you. You take it with your coffee and never think about it. Your refills come automatically. Your doctor renews the prescription without a conversation. It has become invisible. That is the problem. I watched patients take these pills for a decade without a single doctor asking whether they still needed them. The myth is that PPIs are harmless because they are available over the counter. That is dangerously wrong. Over-the-counter availability has nothing to do with long-term safety. Aspirin is over-the-counter. It can kill you if you take it wrong after 70. PPIs were designed for short-term use, 4 to 8 weeks, not 4 to 8 years. Here is what a PPI actually does inside your body. Your stomach makes acid using tiny pumps in the stomach lining. These are called proton pumps. A PPI shuts those pumps down, almost completely. Your stomach acid drops to near zero. That sounds like a good thing if you have heartburn. But stomach acid is not just for digesting food. It is your body's first defense against bacteria. It helps you absorb calcium, magnesium, iron, and vitamin B12. When you shut down those pumps for months or years, 3 things happen. First, your body stops absorbing B12 properly. B12 deficiency causes memory loss, confusion, and nerve damage. It looks exactly like early dementia. Second, your magnesium levels drop. Low magnesium causes muscle cramps, heart rhythm problems, and fatigue. Third, your gut bacteria change. The bacteria in your intestines shift because there is no acid to keep harmful strains in check. New research from 2024 connects this gut bacteria shift directly to brain inflammation through the gut-brain axis. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like Omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. I want to tell you about Margaret. Margaret was 71 years old, a retired teacher from Savannah, Georgia. She had been taking omeprazole since she was 62, 9 straight years. Her original doctor prescribed it after a bout of gastritis. The gastritis healed in 6 weeks. The prescription kept renewing. Margaret started forgetting words. She would stand in her kitchen and forget what she came for. Her daughter thought it might be Alzheimer. They went to a neurologist. The neurologist ran a full workup: MRI, cognitive testing, blood panels. The MRI was clean. The cognitive test showed mild impairment. But her blood work told a different story. Her B12 level was 188. Normal starts at 300. Her magnesium was borderline low. The neurologist asked one question. How long have you been on omeprazole? 9 years. He told Margaret to talk to her gastroenterologist about tapering off. He suspected the PPI was causing her symptoms, not Alzheimer. Here is your first test. Go to your medicine cabinet right now. Look at every bottle. Is one of them omeprazole, esomeprazole, lansoprazole, pantoprazole, or ribeprazole? If yes, answer this question honestly. How long have you been taking it? If the answer is more than 8 weeks, you need to have a conversation with your doctor about whether you still need it. Do not stop it on your own. Stopping a PPI suddenly can cause rebound acid that feels worse than the original problem. It must be tapered slowly over 2 to 4 weeks. Here is your second test. Ask your doctor to check your B12 level and your magnesium level at your next blood draw. If your B12 is below 300, you may already have a deficiency caused by the PPI. If your magnesium is below 1.8, the PPI could be the reason. These are cheap blood tests. They take 5 minutes to order, and they can explain symptoms that look like aging but are actually drug side effects. Things that make PPI damage worse after 65. First, combining a PPI with a diuretic. Both deplete magnesium. Together, they can drop your magnesium to dangerous levels. Your heart needs magnesium to maintain its rhythm. Second, taking a PPI with a calcium supplement and expecting it to work. PPIs reduce calcium absorption by up to 40%. That calcium tablet you take for your bones is passing straight through you. Third, staying on a PPI because you are afraid of the heartburn coming back. Rebound acid is real, but it is temporary. It lasts 1 to 2 weeks. After that, most people find they never needed the PPI in the first place. Fourth, taking a PPI and an NSAID together. This combination is common because doctors prescribe PPIs to protect the stomach from NSAID damage. But the PPI creates its own set of problems. Ask your doctor if there is a better option. Here is what helps. First, apple cider vinegar. 1 tablespoon in a glass of water before meals. This sounds backward, but many cases of acid reflux in seniors are actually caused by too little stomach acid, not too much. Low acid causes food to sit and ferment, which pushes acid upward. A small amount of vinegar can help. Second, elevating the head of your bed by 4 to 6 inches. Use bed risers, not extra pillows. Pillows bend your neck. Bed risers tilt your whole body. Gravity keeps acid in your stomach. Third, eating your last meal 3 hours before lying down. This single habit eliminates reflux in about 40% of people. Fourth, slippery elm tea. A natural coating agent for the esophagus. 1 cup after dinner. Available at any health food store for about $8. This is the Thornton PPI protocol. Step 1. Schedule a conversation with your doctor specifically about your PPI. Bring this question. Do I still need this? And what would a taper plan look like? Step 2. Get your B12 and magnesium levels tested. If B12 is below 400, ask about sublingual B12 supplements, which absorb under the tongue and bypass the stomach entirely. Step 3. Try the lifestyle changes above for 4 weeks before deciding you need the PPI forever. Elevate the bed, stop eating 3 hours before bed, and try apple cider vinegar with meals. Margaret tapered off omeprazole over 3 weeks with her doctor's guidance. She started sublingual B12. Within 2 months, her word-finding problems improved noticeably. Her B12 climbed to 410. Her daughter said it was like getting her mother back. Margaret still gets occasional heartburn. She manages it with bed elevation and meal timing. She has not taken a PPI in 14 months. Write your age below. And tell me, how many years have you been on your PPI? I read every single comment. Here are your 5 takeaways. 1. PPIs were designed for 4 to 8 weeks, not years. 2. Long-term PPIs deplete B12, magnesium, and calcium absorption. 3. Get your B12 and magnesium levels checked at your next blood draw. 4. Never stop a PPI suddenly. Always taper with your doctor. 5. Elevate your bed and stop eating 3 hours before lying down. I made this channel for one reason: the information your doctor knows but does not have 12 minutes to explain. I don't sell supplements. I don't have a clinic. I profit from you not needing me. If this helped even one person question a pill they have been taking on autopilot, it was worth making. I'll see you in the next one.